In today's modern era, we all have come across the term AI. It is the short form for artificial intelligence. Using AI, large language models were developed, which are advanced systems using sophisticated neural networks to process, understand, and generate human-like text. Generative Pre-trained Transformers, or GPT for short, are extensions of large language models, which we use for many tasks, including answering questions and solving problems. Intrigued by this capability, I asked a popular search engine that uses GPT models in January 2026 what would be considered the best surgical treatment for breast cancer and studied its answer. Through the process, I discovered that certain medical facts stated by AI may not be totally accurate. Crucial information was not included during the first run, and in another, it was inaccurate. If you wish to find out what AI missed out and what the correct information is, stay tuned. The details omitted by AI are essential in decision-making about which breast cancer surgical operation to undergo. Many women already know that surgical treatment for breast cancer falls into two broad categories. A patient may choose to undergo a mastectomy, which is the operative removal of the breast, or she can elect to have breast conservation treatment. Breast conservation treatment, or BCT for short, consists of a combination of a complete removal of the cancer with a rim of healthy tissue around it, usually followed by radiation. The surgical component of BCT may be referred to using several terms: breast-conserving surgery, lumpectomy, wide local excision, partial mastectomy, or segmental mastectomy. I chose to use the term lumpectomy for this purpose. In my experience as a surgeon treating breast cancer for decades, when presented with the choice of mastectomy or BCT, patients would invariably ask which was the better or best option for them. I am aware that many women also turn to GPT for an opinion, so I posed the question to some of these AI programs to discover what information they would be presenting to patients. I asked the GPT, which operation is best for early-stage breast cancer, lumpectomy, or mastectomy? Let's now take a look at what AI said and compare that with the actual data and evidence that is published in medical literature. This GPT model said that neither surgery is objectively better for early-stage breast cancer, as both offer identical long-term survival rates. Those who have watched some of my videos would be aware that this is not correct. A panel of experts who convened at the 2025 edition of the St. Gallen International Breast Cancer Conference believe that patients should be advised that BCS, which is the abbreviated term for breast-conserving surgery, and radiation therapy is usually the best treatment option for women diagnosed with early breast cancer. It is therefore evident that GPT had failed to include this vital piece of information in its answer to my question. I wonder if this difference would have changed a patient's decision. This statement by the expert panel is a culmination of more than a decade of work. As early on as in 2007, there was already data demonstrating that breast-conserving surgery resulted in improved survival compared with mastectomy. Having studied the treatment outcomes for 3,000 women diagnosed with breast cancer, this team of doctors led by Dr. Martin concluded that Western Australian breast cancer patients treated with breast-conserving surgery have improved survival outcomes over those treated with mastectomy. This result was repeated by these researchers from the Department of Surgery at the University of Michigan, where it was found that patients who underwent BCT or breast conservation treatment have a higher breast cancer-specific survival rate compared with those treated with mastectomy alone, or mastectomy with radiation for early-stage invasive ductal carcinoma. In 2025, this study from a team in the United Kingdom similarly found that overall survival and breast cancer-specific survival are superior after breast-conserving surgery with radiotherapy and oncoplastic breast-conserving surgery with radiotherapy compared with mastectomy with or without radiotherapy. These studies, which span a period of 18 years prior to my search on 1st January 2026, were not highlighted by GPT. I believe this is crucial information which patients should know when making decisions for treatment. For full disclosure, I wish to say that this video was created with AI assistance. I would like to repeat and reiterate that it is AI assisted. It is different from the literature search and organization of the research data, which was done by a human, me. I have also provided the references supporting my statements, which were missed out by AI, so that you are able to verify and fact-check them. In fact, I encourage you to do so. You will then see that the information generated by AI have sources which are either inaccurate or outdated. Ultimately, as a surgeon who has treated hundreds, if not thousands, of women with breast cancer and has reviewed the treatment outcomes of my patients, I can confidently say that my experience aligns with what has been reported in the studies, which have demonstrated that breast conservation treatment results in better survival outcomes than mastectomy. There are two components to the human element: surgery experience coupled with human literature search. As of this point in time, AI and GPT lack the independent capability to perform surgery. Therefore, AI is yet unable to connect surgery with research data like a human surgeon can. The combined operative and research experience of a human surgeon gives me a dimension that a computer program cannot replicate. Thank you for staying until the end of the video. It is my hope that patients will not be shortchanged by the imprecise or outdated information collated by AI or GPT at this point in time. The scientific data was not acquired by AI, but through much human effort and hard work. It is a human intention to understand the outcomes of treatment to help patients live longer, live better, and live more in their survivorship. In my other videos, I will be discussing more issues which were ambiguous in GPT's answer to my question. I hope you will join me there too. Until we meet again, take care.